Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's pretty outside, a little nippy, but nevertheless, it's a nice day. You need to go out and take a walk after you get done listening to the program. We're here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We have one, and I have a guest, and we're going to be talking about those things that make it very difficult for you to walk and sit and bend and turn, not your back, but your hip, your knee, and your ankle. The pain that sometimes you don't know where it comes from, and you're told that you have degenerative arthritis or rheumatoid, and there's not a whole lot you can do about it except take these pills for the rest of your life. Well, that's not the case, not true. And to help me talk about it so we can unveil it for you, if you will, the professor, Dr. Harlan Browning.
Good morning, Tom. How are you today?
Excellent, my friend. Excellent, excellent. This is a topic that's fun to talk about, particularly from your perspective.
Yeah, I really enjoy this, and especially since springtime's around the corner and people are going to be more active. Now's the time to figure out why we're having these pains and do something about it and get ready for the warmer weather.
This is the topic of our in-house continuing education program this Wednesday evening, the 23rd at 7:30 p.m. at the Roselle Center for Healing. You're going to present, you will be the host, and you're going to be talking about how to put the fire out on these things, but more importantly, the why behind them. You see patients that come into the practice on a day-to-day basis that have been put on all kinds of medications, from Celebrex to anti-inflammatories and so forth, and they're told that, as long as they take this, there's not a problem. The problem underlying all that is not only do the drugs do damage, but it's not resolving the issue, and the issue begins to flare and get worse and cause further degeneration. So let's start with, my question is this. Patient comes in, they have pain in the hip, and they'll have pain in the knee or the ankle. But let's talk about the hip first, because there's so many people that end up with, well, we'll watch and wait and see, and then ultimately we'll do a surgical procedure. Are these real degenerative conditions, or are they something more simple that evolve over on, like a bursitis of that hip?
It certainly can be both of those things. And, for hip problems, the interesting thing that I find is that most people don't understand where their hip is. So when they point to what they think the hip area is, they're actually pointing to the lower part of their back or their sacroiliac joint. So the first thing we have to determine is their hip problem really coming from where the bone goes into that joint, or is it coming from the low back? So most hip problems, especially the degenerative nature, actually cause the pain to be in the front part of the leg, in the crease, kind of going down to the groin area. So if your pain is on the back part in the big butt muscles, then it might not be the hip joint itself that's causing the problem, and it may be the big joint of the back part of your spine called the sacroiliac joint.
So when we're talking about the sacroiliac, people say, my doc said it was this, my doc said it was that. First, anatomically, we've got so many different parts of this area, and unless doctors are really careful about the distinguishing characteristics of these areas, it becomes almost impossible for them to determine. You've got muscle, you've got joint spaces, you've got nerves, you have pads in there called bursa, you have ligaments and fascia and so forth, and they all have different characteristics relative to pain pattern. You can have pain right in the buttock area in the middle of it, and there's an acupuncture point there called gallbladder 30. There's an area that allows for the exit, if you will, of a nerve called the sciatic nerve, which is really not one nerve, it's 5. How do you distinguish? Let's go into the distinguishing characteristics of these tissues. And, you said initially it could be the sacroiliac, but how do you really know which one it is? And then we're going to talk about identification and what can be done about it.
Well, certainly what the patient tells you gives you a lot of information. When does the pain actually happen? Is it first thing upon arising in the morning that gets better with movement? Well, then chances are that's probably a degenerative situation or arthritis. Is it worse as the day goes on, as they move more? Then that's probably more likely going to be a tendinitis or a bursitis. And then the exact location gives us a lot more information. And also, does the pain refer? Is it really localized? Can they put their finger right on it? Or does the pain kind of take over a broad-based area? So between all of those different scenarios, you're going to really find the problem somewhere in between. But very often, especially in the older population, there's usually a little bit of degeneration and a little bit of tendinitis and a little bit of bursitis. So everything kind of gets lumped together. So you need to address all those problems at one time.
So you can't isolate anything. There's the thigh muscle. Let's take that for just a topic of conversation for a moment. That thigh muscle is a 2-joint muscle. It allows the knee to move and allows the hip to move. And that thigh muscle has nerves that go to it. Generally, we'll talk osculate 1 and we'll say lumbar 3. That's a nerve that comes from the low back, if you will, and goes to that thigh muscle. So what comes first, the chicken or the egg? Do you have imbalance that comes from the knee or the foot, or do you have problems with the back that causes an imbalance in the muscle, which causes a hip problem?
It certainly can be both, so you have to look at equally at both parts of that. If you take a really good history, ask the person when did it really start. That's probably going to give you an indication if it actually was primarily a hip problem, or maybe the problem came from the low back and the nerves that innervate or supply the information to the muscles that support the hip. So over time, those muscles have gotten weaker, and the end product is the person has some early stages of degeneration or arthritis and pain from it.
888-630-9625. That's 888-630-WMAL. My guest in studio, Dr. Harlan Browning, your host, this Wednesday evening, the 23rd of the month at 7:30 p.m. at the Roselle Center for Healing. Dr. Browning is going to be talking about, obviously, hip pain, knee pain, ankle pain, how to distinguish the characteristics among them, but more importantly, what you can do preventively, and what you can do other than drugs and surgery. If you'd like to attend that class, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend this Wednesday evening's presentation on hip, knee, and ankle pain. Listen, golf's coming up, tennis is coming up, walking and hiking and so forth, and you've been putting things off. Said, well, if I take a couple aspirin, it goes away. Well, taking a couple aspirin, it only masks a problem that ultimately is going to give you further problem, maybe lead to unnecessary surgery, meaning surgery on this part of the aisle you can do something about, where later on that you can't. Dr. Browning, Harlan, let's talk a little bit more about how these things happen. We're talking hip, knee, and ankle pain. They're not isolated. They contribute to each other. When one, it's the old saying that the ankle bone's connected to the knee bone, connected to the hip bone, and so forth. So you have this constant mechanical balancing act that you have to deal with. So patient comes into the office, and you have to make a decision. How do you treat them? They say to you, I've had this pain off and on now for many years. It's getting progressively worse. My doctor tells me it's an arthritic condition of the joint space, and I have to take these medications to keep the pain away. How do you distinguish?
Well, it certainly may be an arthritic condition, but that's not the end-all be-all. That's the byproduct of instability in the joint, or possibly there was some injury to the joint, maybe 4, 5, 10, 20 years preceding that. If you're just going to address the problem by giving an anti-inflammatory medication, you're never really addressing the instability that's there in the first place, meaning that if there's musculature that's too short or musculature that's too weak, the position of that bone, the femur, is not going to sit ideally in that socket. There's a cartilage cap that surrounds everything called the labrum, and it would prefer not to be compressed excessively. And what happens is over time that cartilage cap will get worn down, and eventually we get closer to be bone on bone. This doesn't happen overnight. So the quicker the person can identify the dysfunction they have, the biomechanical dysfunction, or the ability for that leg to move normally, the quicker they can bring it back to center and prevent the problem from getting worse, and certainly make the pain go away.
You know, there are patients that come into the practice and they say, you know, when I go from a sitting to a standing position, it hurts. You know, but if I walk around for a while, it gets better. It never goes away, but it's better. If I'm up on my feet for a long period of time in one position, the pain come back raging. But as I said, it's never. How do you distinguish those characteristics? Here's a joint that you can't sit on, and if you get up, it hurts, but if you move around, it's okay, but if you move around too long, it's not okay.
Yeah, that definitely sounds like a person that has a lot of degeneration in the joint, where if a person said that maybe when they get up from sitting, they feel like a sharp stabbing pain, and then it goes away real quickly, that sounds like something's getting entrapped, maybe that labrum or maybe some soft tissue. I always tell my patients, especially the ones that have that dull, long-lasting pain that's been going on for a long time, that's probably the one that you want to look at as soon as possible, because there's a degenerative process in place, and it's not going to get better by resting, and it's not going to get better by taking those anti-inflammatories. So it's one of those things where a person needs to take an action step and decide for themselves how much do they want to do to recover their health, because really at that point it's about what they need to do to help the situation get better.
Now, a lot of patients, as we get older, are going to be told by their doctors that they will have more pain simply because of the progression of age and degeneration. They're going to be told that at some point they're going to have some form of reconstruction or remodeling done. And, you know, you're looking at, in the initial stages, you're looking at joint spaces that are not mechanically sound. When you see a joint, we look at posture, we look at mechanics, we look at muscle strength, we look at muscle weakness. How effective can you be once the pain is there relative to, one, the elimination of the pain, restoring normal joint mechanics, and allowing a patient to rehab to a point where they can have a normal life without the medications, without potential surgery? Where's the dividing rod? Where's the decision-making process?
You know, I think that the line gets drawn in the sand depending on the extent of the degeneration. And for those folks that put off a problem that eventually turns into bone on bone, where the person has very limited mobility, the leg will not straighten out, that person is in a little bit more dire straits than folks that still have really good mobility and still have some good strength in the leg. Now, having said that, most folks that come into my office and certainly into orthopedics office and things like that are not necessarily bone-on-bone people. You do see it, definitely, but that's not the majority of folks. So I think the line in the sand really becomes when the person lets it get too far away, and not only do they have irretractable pain, they've lost function. They cannot move that leg regardless of how much they try.
That's ultimately the thing that we want to avoid, and we have
Correct.
so many patients that come in and they're almost there. They've put it off for so long. They've been taking all kinds of medications, and it's just not okay. This Wednesday evening, Dr. Harlan Browning is going to talk to you about hip, knee, and ankle pain, how you can do something about it, the exercises that are important, what to avoid, what's the progression. 888-630-9625 is how you talk to us today. If you'd like to attend that class at our office, it's 703-698-7117. That's 703-698-7117. Don't hesitate. This is something that is only going to get worse if you're having a problem with it. We're talking about not only prevention but management. Doc, real quickly, you have patients that come in and they're on the Celebrexes, the high-potency aspirins, if you will. Do they work?
They'll make the leg feel better. I mean, there's no discrediting the pharmacological effect of them. The end product is if you're taking those on a chronic basis, in other words, you're taking them daily or multiple times in a day, there's a counterproductive effect, because they also impair the utilization of sulfur, and sulfur really is the meat and potatoes of our joints. So when people take things like glucosamine sulfate, they're taking it for the sulfur that's in it, or MSM, methylsulfonomethane, that's got sulfur in it. These are all the nutrients that we see on TV all the time. So if you want to just feel better and have the problem continue on, then the Celebrexes and those things will probably be your best bet. But if you want to handle it, you need to figure out what the process is that's causing the pain to be there in the first place.
Not to mention the side effects of those types of medications, and they're called heart failure at certain levels, and they took these products off the market for quite some time. We got to take a break. We're coming up for some very important messages and some people that we have to pay tribute to for thanking them for being sponsors of Dr. Tom Roselle Live. Don't go away. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. 888-630-9625. 888-630-WMAL. Love to talk to you on any subject that you have in mind. If you don't like to call and you want to talk to us anyway, you can call the office at 703-698-7117. That's how you also register for Dr. Browning's presentation this Wednesday evening, the 23rd at 7:30 p.m. He's going to be talking about hip, knee, and ankle pain. If you'd like to send us a note, go to rosellecare.com, ROSELLECARE.com, or drtomroselle.com. All those things will get you to us, and we'll be more than happy to respond to you, share the information that you need to have to make decisions. We're dedicated to making sure that you're taking the direction, taking the action steps that you need to take. 888-630-9625. Dr. Browning, Harlan, let's talk about this nasty arthritic condition of knees or hips. And, when you're talking about knee and hip pain, what comes first? Which one's setting the other one up? Other than trauma. Obviously we know that traumatic situation can cause a problem, but you've got these joint spaces that are interrelated, and also the ankle. How do you distinguish who's the culprit? And many times you're going to have joint space that's going to be painful, but it's one of the other ones that's causing the problem.
I don't know if you definitively could say which came first, but if I had to say in my clinical experience, I would probably say hip dysfunction leads to knee dysfunction a little bit more than the other way around. And the reason I say that is because when we talk about dysfunction, we often think about that as it references pain. Now, when I look at dysfunction, and I certainly know you do this as well, I think of dysfunction as a lack of normal activity, or a lack of the inability to do something that you should be able to do. In other words, does the joint have freedom of movement with or without pain? So very often people have excessively tight hips because they sit all day. And if they do, then the leg bone can't move accordingly. So unfortunately, the knee is caught in the middle, and it's going to often be overused or used inappropriately as a person walks, which over time leads to degeneration of the joint.
Here's a little situation that most people wouldn't think about, and most people doing the work that we do won't think about. From chiropractors to orthopedic surgeons to neurosurgeons, when you have hip pain, and our friend Dr. Michael Chung, who we send a lot of neuromuscular dentistry to, understands this, that when the temporomandibular joint locks up, there's a muscle that helps open and close. It's one of the hinge muscles. And when that jaw is not working, the hip is not going to work. And when the hip is not working, it's also going to cause the jaw not to work. And that's a little muscle called the pterygoid muscle. First time I learned that some years ago, it blew my mind. And repetitively in clinical presentation, I've seen it over and over again, where if the jaw muscle, the pterygoid, is too tight, then the adductor muscles, the muscles that pull in towards the center line of the body, of the hip, are also going to be way too tight and not have enough lateral motion, so that bone sits in that pocket and begins to degenerate.
Yes, so it's as odd as that combination or correlation seems, we can actually explain it. The body moves in a reciprocating motion, meaning that as I move my right leg forward, my left arm moves forward, and that's to keep us balanced, so we're not walking like a crab. As that right leg moves forward and the left arm comes forward, then my head is going to counter-rotate and turn to the left as well. So as the head moves to the left, the musculature on the right side of my neck is going to contract. Well, because the right leg is moving, that means that the right musculature of the leg is also contracting. So there is your neurological correlation. The same side leg muscles contract at the same time as the same side of the cervical spine and the TMJ or the jaw. So as we walk, and that's how we're hardwired, these two reciprocating things take place on and off and on and off and on and off. So if we have dysfunction in the hip, it actually can affect the jaw, and vice versa. A little bit more jaw to hip than it is hip to jaw, but nonetheless, when you show a patient that correlation and you get in there and you release that pterygoid in their jaw and you show them how much hip motion they recover, it's mind-blowing.
I know we deal with a lot of golfers and tennis players, and sometimes their rotational motion won't open up until, you can play with that hip, until you fix the correlating muscles. They're locked down, and nothing that anybody does, stretching, heat, more strengthening of other muscles, it just doesn't work. This Wednesday evening, January 23rd, 7:30 p.m., Dr. Harlan Browning will be your host and your presenter at the Roselle Center for Healing, talking about hip, knee, and ankle pain and all those little things you wouldn't have thought about relative to why they're there, just like this temporomandibular joint relationship. Got to come up and take a break for the news and for some important information. We have much more for you. Don't go away. Make sure you're back afterwards. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about hip, knee, ankle pain, from just a bruise and a bump and a bursitis to degenerative changes to things like the temporomandibular joint can cause. We're going to talk a little bit more about different types of body actions that you wouldn't think about. However, before we do that, let's go to the phones. Linda, how can I help you?
Hi, Dr. Tom and Dr. Browning. It's Linda Capocha.
Hi, Linda. Hi. Good to hear your voice.
Yes, and God bless you guys for what you do. I spread the word as much as possible to get people to listen to your show, and the subject today really resonates with me, with my sister, who has a very stressful job for over 40 years, sits down during her job, but also does horseback riding and has come off her horse, but she has TMJ issues. She's always cracking a filling or something, and she always has hip problems.
Very, very common presentation, Linda. Dr. Browning, you want to jump into that?
Hi, Linda. How you doing?
Hi. I'm doing great.
Good. It would seem counterintuitive that the hip and the jaw would have anything to do with each other, but, as time goes by and we learn more about the wonders of the nervous system, we really understand that there's huge, far-reaching effects of what goes on in the neurology. So everything from our foot all the way up to our head. But to touch on the effect of the TMJ, what's most likely happening? She's clenching, or we call it bruxism, which means that those muscles in her jaw are constantly being loaded. And when that happens, you're going to reflexively, through the nervous system, increase tension in the musculature, the deep complete muscles of the hip to accommodate for that. So as those muscles tighten up, the femur or the leg bone is going to sit slightly higher up in the joint, and that's going to cause maybe some stiffness in the beginning, but over time it's going to cause a pain component. If that stays in place long enough, it certainly could lead to some degenerative changes as well.
Now, a little interesting story springboarding off of that. Some years ago, when the women's LPGA used to come into Washington, I used to treat many of the ladies, and this one golfer was having problems when she would hit the ball, was hooking it, and nothing that they could do would break it. So I went out to the course and I watched her, and her rotation in her hips wasn't as complete as it should be. But what I noticed as I was watching her hit balls is that every time she hit the ball, she would clench her teeth. So I took a T, one of the things that they put the balls on, and I put it in her lips, and I said, "Don't bite this. Concentrate on not biting it." And she would put the ball up, and she would hit it, and as long as she did that, the ball would go straight. So we sent her out to a dentist to have that corrected, but that's a very, very common correlation. So
wow.
You got to get your sister to have that checked out to stop that, because otherwise she'll continue having the problems that she's been complaining about.
Absolutely. Finally, after years of prodding, she does go to a chiropractor periodically.
Excellent.
But she lives so far away, I've tried to get her to come into you guys. But I've had other friends and neighbors and all have hip replacements, and I always attempt to encourage them to find another alternative to replacement to see if they're a candidate to resolve the issues without such a traumatic surgery.
Linda, thank you. Appreciate
all
it.
right.
Dr. Tom, let me add something to this, because it's Sunday and all the NFL games are on, the playoff games. Now, when you watch these players out on the field and you see them between plays, especially the quarterback, they'll take out their mouthpiece. Now, don't underestimate the power of that mouthpiece. It's not just there so they don't have their teeth knocked out or they bite their tongue. If you have a moment today and you got your laptop with you, why don't you go in there and Google the technology that's involved in these mouthpieces, and what you'll find is that these manufacturers have clinically documented studies that show that when they can engineer the mouthpiece that's correct for that person, it increases their 40 time, that's how fast they run, their vertical leap, that's how high that they can jump, and their reaction time.
And how much weight they can put up?
Yeah, so it is it's fascinating how powerful the jaw affects us. So it even carries over to really healthy guys, but it takes them to the next level.
You're talking about tension and clenching and stress that we manifest relative to temporomandibular joint pressure and compression, and often we don't even know that it's happening. And also patients who have had dental work causing the jaw to be mixed. People who have parasites will also have clenching problems and grinding problems that ultimately do affect the hip and the joint spaces of the lower extremity. And again, as you said earlier, the more we understand neurologically, the more we understand how the visceral system affects other portions of the body through the nervous system, how we have one joint space mechanically. We were talking at the break about how shoulder problems cause problems in the hip joints and the knees of the opposite side. Let's get into that a little bit.
So, because the nervous system is designed around that reciprocating ability for us to move, and we call that gait, if we have dysfunction on one side, it's going to present as a dysfunction on the other. And again, we got to remove ourselves from this pain paradigm. Just because something doesn't hurt doesn't mean that there's a problem. So if you have an injured shoulder, and let's say the shoulder is really tight, when you walk, you're not going to swing that arm as much. Well, when you don't swing, let's say, the right arm as much, you're not going to move the left leg as much, because remember, they move together as we walk. So over time, the body has to adapt to keep us balanced, so we're not just flailing an arm around or moving around like the crab. So one of the things that I look closely at, it's certainly more so with athletes than with the general public, but it carries over to that realm too, is if a person has an unexplained hip or knee or whatever problem, I'm always going to look at the joint on the opposite side that complements it. Do we have full range of motion? Ask the person, have you ever injured it? And inevitably, and a lot of these folks are like, well, how did you know that? Well, I know it because when I watch them walk, not only does that bad hip they come in for not move right, but the shoulder on the opposite side doesn't swing right either. So you often have to treat the neurology to treat the local problem in the joint.
It's mind-blowing.
It is mind-blowing.
Still, after, even for me, after all these years in dealing with patients on a day-to-day basis, you see these things come in, and for you and I, we look at it and we start asking questions that seem to be very straight up relative to biomechanical function of the body. But when you ask the patient, what have you done about it? If they've had anything done as palliative, if they've had a doc that has some insight, they may have sent them out for therapy. But other than that, it's a wait and see on the allopathic table. So much can be done. You don't have to suffer with these things. These are conditions that can be turned around, but the identification of what's really taking place has to be understood thoroughly. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject, and like to remind you that this Wednesday evening, January the 23rd, 7:30 p.m., Dr. Browning is going to be your host at the Roselle Center for Healing, talking about hip, knee, ankle pain. This is an opportunity truly to find out what you can do proactively and get off these medications that not only have bleeding problems in the intestinal tract and liver and kidneys, but also can affect your cardiovascular system to the point where they can cause death. These drugs should not be taken mildly, and we're talking about things like aspirin and ibuprofens and ketoprofen and naproxen, all of these anti-inflammatory non-steroidal NSAIDs, as they called them. Do they reduce pain? In many cases, yes. Do they decrease the inflammatory process? Yes, for a short period of time. Actually, if you're being given these drugs for an extended period of time, the anti-inflammatory process has stopped. Initially, they work with something called they're COX-2 inhibitors. There's a whole enzyme pattern that they're trying to prevent from expanding in your body, causing the pain. Dr. Browning, let's talk a little bit more about the mechanical disruption that comes about from treating, if you will, the wrong area.
Well, the first thing that you have to always look at is most problems become global after a while. In other words, there's an adaptation that takes place. So if a person comes in with a hip problem or a knee problem, we need to assess the range of motion there. Do they have full range of motion or don't they? Is the musculature that supports the joints, the muscles in the front and the back and inside and the outside, are they equally functioning? In other words, are they supporting the joint the way that it should? And then simple things, the way people sit, stand, sleep, work, and do all those things, they can slowly sabotage themselves because they spend more time on their butt than they do on their feet. So the problem becomes perpetuated because as we sit, certain muscles become stretched and certain muscles become short. And that's not going to help the situation, certainly as it relates to a joint that's becoming degenerative over time. So you always want to consider that. And lastly, let's throw this in here. If the nutritional status of the person, so to speak, is not good, let's say they have a horrible diet or they're dehydrated, that's a biggie, they just don't drink enough water, then the joint is going to take the brunt of that abuse, and we're going to see a chronic inflammatory situation set up shop, and we're going to see the fluid in the joint become less than it should, which means that there's less lubrication, and less lubrication means more friction, and more friction means more destruction.
You know what I like when I ask patients, how much water do you drink? Oh, I drink a lot of water. Quantitatively, how much do you drink? And then people sit there and they say, well, I have 3, 4, 5 cups of water a day. Unfortunately, that's not nearly enough. The body needs a lot of water, and we're talking about the half your body weight in ounces on a day-to-day basis is a minimal amount of water that you should have. And water triages, which people don't really understand. What I mean by triage is when you have a cup of water, and if it's the first cup or 2 or 3 for the day, it's going to go to the organs of survival. It's got to go to the heart, it's got to go to the liver, it's got to go to the lungs, it's got to go to the kidneys. Then whatever additional water you get in goes to soft tissue. Then ultimately it goes to the least survival organisms relative to your potentiation, and those are the joint spaces. So if you don't get enough water, the last pieces of tissue, if you will, or structure in your body that gets any of it are the joint spaces.
Yes. So you know, what you put in your mouth is eventually going to catch up with you. So if you're not drinking the water, or if you're just eating lots of refined carbohydrates or bad fats or bad oils, it's going to set up kind of a witch's cauldron of inflammation in the joint.
It's an acidic inflammatory matrix, if you will, that you have to avoid. Because anytime there's inflammation, and now I'm going to scoot into what happens with joint degeneration, inflammation is acid. And if you're eating things that are acidic to begin with, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, the junk, if you will, and you have an injury or an imbalance structurally, the acidic levels get that much higher.
Yes.
And now you got to put the fire out.
And the only thing that people know to put that fire out is more anti-inflammatories or more aspirin. So it's just it's a vicious cycle.
If you were to talk about how people can identify where the problem is coming from, you know, we've talked about joint problems coming about from opposite joints. We talked about joint problems coming about from TMJ. We talked about joints problems coming from trauma, and they could affect many different tissue substances. How can someone on their own say, you know, it's not just a strain, but it's something mechanical, and this is where it's coming from, and I need to see somebody yesterday?
Well, you know, that's a tough question. It's almost a loaded question. Certainly, I think if someone has had a problem for a long period of time, and I'm gonna put that in the over the month category. Most people think of something that's been around for a month, not a big deal. Well, in my opinion, it is a big deal. The body has an amazing restorative capacity, and it can heal itself. There's just no doubt about that. But when a problem takes long time, 4 weeks, 6 weeks, or certainly years, there's an instability there that's probably not going to right itself by what you're currently doing, meaning your exercise regime or your stretching regime, or maybe you're not even doing any of that. So at that point, if something's just not getting better, or maybe it's getting worse, it's best to have it looked at early on, because the likelihood that you have permanency in that problem, in other words, the joint is actually degenerated, is a lot less. Most folks wait and wait and wait, but the waiting process usually comes with a certain amount of damage that's actually visible, and that can become, you know, more or less permanent unless the person acts upon it.
888-630-9625. How you register for Dr. Browning's class this Wednesday evening is 703-698-7117. That's 703-698-7117. We'd love to have you. Anytime that we present these programs, they're there for your benefit. We try to present as much information as we possibly can so you can make some choices in your life that otherwise you may not have thought about, and see if we can put it together. You're going to go away with different types of things that you can do preventatively. You're going to understand the mechanics of your pain. You're going to really get down to, I really can change this thing and turn it around. We have to take a break, and we'll be right back. And when I come back, I'm going to talk to you about something that you can do to fix a lot of things that are bothering you. This is Dr. Tom Roselle.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live, reminding all women to conduct monthly and annual breast exams. Also consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram, and it's safe and non-invasive. For more information, call 888-485-7736 or visit thermographycenters.com. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We are in studio. We've been broadcasting to you from 888-630. The station is WMAL. Always every Sunday, 12 o'clock. I'm here with the likes of Dr. Harlan Browning today and other people who are giving you the best information possible so you can help yourself, you can prevent things from happening, you can take control of your life and make yourself better than what you are today. That was the purpose of the book I wrote, by the way. Ageless Health. Health is a do-it-yourself program, because the truth of it is in your hands. If you have the information, you know what to do, you can change virtually anything. But most of us put everything off. we'll say, we'll wait till it gets worse. We'll wait till something else happens.
It's a really good point, and I just like to add to that. One of the reasons that I do the talks in the office is just to give people more information. So we certainly have folks that come in and don't have hip problems, but they just want to learn about it. And I think that's great, because you know what? If they learn about it, they might run into that person that does have the hip problem, and they're going to be able to say, hey, did you ever think about this, or did you know this? So it really is about education.
That's why we do it. That's why we set up the new website, too, drtomroselle.com. If you go into that website, you're going to be able to re-listen to these classes. They'll cost you just a few dollars, so you can sit there at the leisure of your own computer in your own house to be able to study everything from allergies to hip problems to headaches to migraines to food menu planning and so forth. It's all there. That's why we decided to do that. Let's go to the phones. John, thank you for calling. How can we help you?
Yes, good afternoon.
Good afternoon, sir.
I have pain in my groin, crotch area. That started like a couple of days ago, and I don't know what caused it.
Have you ever had the problem before?
No.
Does it feel deep in the hip? Deep inside, or is it superficial?
It feels superficial.
Does it hurt when you move, or is it just there all the time? Does it make a difference in position?
It comes and goes.
Okay.
Like I was coughing, and then it started hurting, and then it went away.
You said you were coughing at the time? Well, your abdominal muscles actually attach way down at the bottom part of your pelvis, so certainly you could have strained the abdominal wall, which is pretty close to your hip area as well.
John, do you do any kind of exercise on a regular basis?
I climbed a steep, flight of stairs at a concert on Friday night.
It could be the climbing. It could be the imbalance of the hip. It could be something that was there predisposing before this took place.
I was told that I have an unbalanced hip before with a chiropractor.
Yeah, so you probably have a leg length discrepancy, meaning one leg is a little bit longer than the other. Is that what they told you?
Yeah.
Yeah, so if we have one leg longer than the other, then the musculature has to adapt to that. So very often it becomes a little bit tighter on one side. So if the muscles are real tight and we work them beyond capacity, then we can strain them. And because the abdominal muscles are right there as well, when we cough, that there's a violent contraction, which is normal, of all those muscles as well, so that can kind of push us over the edge. So if that continues, then that's something you want to get looked at, but most of the time that sounds just like a strain.
Yeah, John, give your chiropractor a call. I think it's something that can be helped pretty effectively. It definitely is a sprain type of situation based on the information that you gave us. It could be something else. Dr. Browning, 30 seconds. What are you going to talk about Wednesday night?
Well, we're going to talk about, as you know, when I do my presentations, we're going to talk a lot about anatomy and neurology. I want people to understand the way the body's laid out and the way it works. We're going to talk about common injuries or common pain presentations that we see in the office or that we see in the general public. And then we're going to talk about two things: palliative ways to handle the problem and corrective procedures to handle the problem.
If you'd like to attend Dr. Browning's presentation, 703-698-7117. We're here every Sunday bringing you the most up-to-date information possible, and you can always get a hold of us off the air. This is Dr. Tom Roselle. We'll see you next week. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.